This is a new pandemic. We're now fighting a new enemy. The new variants are far more dangerous than before.
Ontario is hoping to put the brakes on surging COVID case numbers. Starting tomorrow, a province-wide shutdown will take effect, closing patios, indoor dining, and personal care services. Retail remains open at reduced capacities. Meanwhile, Quebec has shut down schools and non-essential businesses in 3 cities. Quebec City, Lévis, and Gatineau are under a curfew until April 12th.
We are likely to be in for a rough ride for the next few days.
And in British Columbia, there's what's being called a 3-week circuit breaker. Indoor dining is on hold, as are indoor fitness classes and worship services. All of this as officials are racing to get vaccines into as many arms as possible. So we thought this would be a good time to discuss some of these issues with 2 infectious disease experts, Dr. Lynora Saxinger, who is in Edmonton, and Dr. Zain Chagla in Mississauga, Ontario. And Dr. Saxinger, let me start with you. What is the situation in Alberta?
Well, in short, I actually find the numbers very grim right now. I mean, we're having increasing proportion of our cases from variants of concern, and the case numbers are really very high now, over 1,000 cases a day, and we haven't seen that for quite some time. We do not yet have the influx into hospital, but it's starting, and we would expect that to continue to go up over the next couple of weeks for sure.
And earlier this week, Dr. Saxinger, some doctors in Alberta urged the Premier, Jason Kenney, to implement some sort of circuit breaker, given the rise in cases, particularly of the variants, but no new restrictions have been brought in. Is that the right way to go?
You know, I actually really think that probably behind the scenes right now, there's a lot of debate back and forth about what restrictions will look like rather than whether or not there will be restrictions. I would have been more comfortable if something had been put into place before the long weekend, because I think that this will be a tempting time for people to start getting together again. And I'm really quite concerned about that. But I kind of expect we're going to be seeing some changes next week.
And Dr. Chagla, what are you seeing in Southern Ontario?
Yeah, I mean, case counts are rising, particularly in the GTA and Peel region. We're seeing younger people end up in hospital. We're still seeing some of the same demographic, older individuals, although many without past medical history. And I think the big thing is, particularly with my hospitalized patients and ICU patients, they didn't do anything to get COVID-19. They're often put in precarious situations, either by housing, by income, by work, by the people that provide care for them. Where they had to come into contact. There was nothing they could do. They couldn't mitigate the risk, and it's obviously quite tragic to see these people where societal measures won't necessarily have a big impact on them.
In Ontario, we heard a lot of talk about shutdown, lockdown, whatever you want to call it. And one of those things included closing down patios at restaurants. In British Columbia, Dr. Chagla, by contrast, household members at least can still dine on patios. What's your view on that kind of restriction in terms of trying to reduce infections?
Yeah, I mean, I think there's something to be said about risk mitigation here, that people, when given the tools to do the right thing, can do the right thing. A household going to an outdoor patio, particularly one that's not a tent, that's open to air, is a low risk scenario. It's a low risk to the servers actually serving them. And as long as they're adhering to that one household limit, I think it's very reasonable. And in fact, probably gives people an outlet to feel like they can do something normal. And so, I think there are reasonable opportunities. And I wish Ontario would have actually thought very carefully about invoking a rule like this. Because again, the last thing we want to do is drive those people that are on outdoor patios indoors and lead to more transmission.
And Dr. Saxinger, and I assume this is the case with many areas of infectious diseases, we're dealing not just with the medical and scientific part of this, but also the social part of this. And a lot of people are really missing social interaction. How do you balance that? What do you suggest for people in terms of being safe, but also the people who want to get outside and get together?
I have so much sympathy for that feeling. I think everyone is feeling it. I guess my comment is that a lot of people have done a great job so far, and it has been difficult, and they have made the tough choices to do the restrained thing, to choose the safe path, to not do the thing that they really wanted to do for a long time. And we're in a phase right now that's really coming into an end game, and we do have an opportunity here to mess it up badly, and it's not that much longer. And so really thinking creatively about all the things we've done so far that have managed to keep us together, and choosing those for a while longer, I think is really my message. Because, anyone who actually gets ill, hospitalized, and dies during this phase of vaccine rollout, to me, is even more tragic than all that has gone before.
Dr. Saxinger, as these numbers have gone up, we've seen it in Ontario and BC, Alberta, and some other provinces as well. I sense that people are feeling kind of despair and pessimism. From your perspective, both as a doctor, but also as a person who lives in Edmonton, how are you feeling?
I think that it's a bit of a roller coaster. I keep on, every time someone tells me that they or their loved one who's at risk has had a vaccine, it lifts my heart a little bit. But it also has been a really terrible grind, and people are very tired of it. And I think a lot of people are kind of feeling close to just kind of throwing in the towel. But honestly, if you look at the long game, this phase is so important, and it's not that much longer. I really feel that everyone still has enough grit, I think, to pull themselves together and keep on doing those tough things, as they have so well for so long, to get us through the next even several weeks will make a very big difference.
And we see you, Dr. Chagla, nodding your head. How about last word to you, a last message to Canadians on this Good Friday?
Yeah, I think we can see our future. I want to go to London, UK. This is a place that has been devastated by the pandemic, where B117 was the initial variant. And guess what? They're coming out of lockdown. They have a huge vaccination strategy where 50% of their population has received a first dose. London, a city of 9 million individuals, had 0 deaths on 2 consecutive days this week. So there is a light at the end of the tunnel. That's our future in 2 months if we can get to those numbers. We just need to buckle up now to get to that point.
But Dr. Chagla, when you look at London in the UK, what is the lesson there other than, the signs of that there is light at the end of the tunnel? What's the lesson for Canada?
Yeah, again, we need time for vaccines to get in, and positioning them properly, getting them into the population, getting them into people at high risk of hospitalization, getting them to areas where things are transmitting is going to have large impacts on this pandemic. We just need time to get there.
And Dr. Saxinger, we have less than half a minute. As far as you know, how are things going in Alberta with vaccinations, hesitancy, rollout? Is it going well?
At the moment, we are not short of people who want to get vaccines. That's still going well, and we're actually putting out vaccines as quickly as they're coming in to a large extent. So really, that is going okay, and I'm feeling quite optimistic about that.
Okay, you know what? You're feeling optimistic on that. Good place for us to stop for now. Thank you for giving us some time on this long weekend.
Thank you.
No problem.